Thank you for watching the UCLA Global Health Pre-Travel Health and Safety Training module. Topics to be addressed in this health and safety module include food and drink safety, malaria prevention and prophylaxis, Zika virus, pre-travel vaccinations, occupational exposure, HIV and post-exposure prophylaxis, environmental safety, and the prevention of injuries. The most common travel-associated infectious illnesses are typical, non-specific viral illnesses that can be acquired anywhere in the world, even in the absence of particular travel. Other common entities include foodborne illness, such as traveler's diarrhea and hepatitis A. Vector-transmitted illnesses are also of concern to the traveler, including but not limited to dengue fever, malaria, and rickettsial infections. We will now discuss the common element of traveler's diarrhea. Traveler's diarrhea is one of the most commonly occurring symptomatic illnesses of travelers, occurring in up to 20 to 40% of all travelers, and generally begins between 4 and 14 days of arriving in country. Symptoms include greater than 2 loose stools per day, with or without nausea, vomiting, fever, abdominal pain, and bloody stools. High-risk areas include Asia, Africa, Mexico, Central and South America. The causes of traveler's diarrhea range across a wide variety of bacterial, viral, and parasitic etiologies, as shown here on this slide. Important to preventing traveler's diarrhea is making healthy beverage choices. Drink only bottled, boiled, or properly treated water. Remember that freezing and mixing with alcohol does not sterilize water, even hard liquor. Please note that outbreaks of diarrheal disease have been associated with contaminated bottled water. Even using local water to rinse food, wash kitchenware, or brush one's teeth can put one at risk of acquiring traveler's diarrhea. When bottled water is not available, there are numerous methods available for water purification. If you have access to a stove, boiling water for 3 minutes is a viable option. Alternative methods include use of antiseptic agents, such as adding specified amounts of bleach or iodine to a given volume of water in order to sterilize it, although these may add an unpleasant taste to the water. Another potential method is to employ the use of a water filter through which one can collect or directly drink purified water. The best method of obtaining clean drinking water will depend on the specific circumstances of one's travel and should be anticipated prior to arriving in country. Of equal importance to making healthy beverage choices is making healthy food choices. To decrease the risk of traveler's diarrhea, one should eat only well-cooked meats, fruit, or vegetables. When eating fresh fruits, it should be fruit with a protective peel or rind that has been removed by oneself with clean hands. Please note that condiments may be contaminated, and street food is in general high risk, even if cooked. Note that large tropical reef fish may contain toxins that are not killed by cooking and should be avoided in general. Prophylactic therapies for the prevention of traveler's diarrhea are available. Bismuth subsalicylate, commonly known as Pepto-Bismol, and probiotics have been shown to be beneficial. Depending on your individual circumstances, prophylactic antibiotics such as fluoroquinolones or rifaximin may be considered. It is important to discuss the available prophylactic therapies with your provider when seen for the pre-travel consultation. The initial treatment of traveler's diarrhea is to ensure adequate rehydration with clean water and oral rehydration salts. Antimotility agents, such as loperamide, can be used with caution if having diarrhea without blood or fever. Your provider may have prescribed a short course of antibiotics, such as azithromycin or a fluoroquinolone, to use in case of watery, uncomplicated diarrhea. However, if you have fever, severe abdominal pain, or notice blood in your stool, you should seek medical evaluation. This slide is a reminder of the importance of staying well hydrated and making use of oral rehydration salts in cases of diarrhea or conditions in which one has become dehydrated. It is always best to keep some on hand, particularly if traveling in remote settings. We will now transition to the issues regarding malaria. Malaria is a parasitic illness contracted from the bite of the Anopheles mosquito. The disease is present in most tropical regions of the world. The infection commonly presents with fevers, shivering, and sweats, and can also have associated headaches, yellowing of the skin and eyes, darkening of the urine, and low red blood cell counts. In severe cases, the brain can become involved. Prevention involves avoidance of mosquito bites and taking anti-malaria prophylaxis. Preventative measures and prophylaxis should be implemented whenever traveling to an area where malaria is endemic, such as the areas indicated here on this map. In addition to avoiding mosquitoes when traveling to a malaria endemic region, it is important to take an appropriate prophylactic regimen. There are many prophylactic regimens available, including those listed on this slide. The appropriate regimen for your travel will be determined at your pre-travel consultation appointment. Please remember that malaria prophylaxis is not 100% effective, and it does not help prevent other mosquito-borne illnesses. Therefore, you should seek medical evaluation if you develop a febrile illness during or up to 3 months after your travel. We will now shift gears to specifically cover the issue of Zika virus. Zika virus is transmitted by the Aedes mosquito, which is characteristically identified by its black and white coloration. The virus has gradually spread around the globe, is now present in most countries in the Americas, and many countries of Africa, Oceania, and South and Southeast Asia. Although generally causing only mild illness in healthy adults, it has been linked to causing birth defects, and it is thus of interest to avoid if pregnant or planning to become pregnant. This map provided by the CDC shows areas with a history of known Zika transmission in purple. Countries colored in yellow are known to have the vector, but do not yet have reported cases of the virus. The map is updated regularly on the CDC website and should be checked prior to travel to avoid unwanted exposure to the virus. Most cases of Zika virus infection are actually asymptomatic or mildly symptomatic. In those who do have symptomatic disease, they will generally experience fevers, arthralgia, a maculopapular rash, and conjunctivitis. One may also experience body aching, eye pain, headaches, and generalized malaise common to any viral infection. As noted previously, the main concern with Zika virus is the potential association with viral infection and birth defects, including congenital malformations and microcephaly. It is strongly recommended that women avoid travel to areas with Zika virus if pregnant or planning to become pregnant. Likewise, their male partners should avoid travel to Zika endemic regions or should use barrier protection until 3 months after leaving the Zika endemic region. Please remember that Zika virus can remain in women and affect pregnancy or be transmitted sexually to their partners for up to 2 months after infection. For men, the virus can be transmitted sexually to their partners up to 3 months after infection. Therefore, it is recommended to avoid pregnancy and make strict use of barrier protection during those time periods to avoid transmitting the virus to one's partner and to avoid complications during pregnancy. To conclude this segment, it is necessary to remind of the importance of implementing measures to avoid mosquito bites as much as possible to decrease the chances of contracting malaria, Zika virus, dengue, and other mosquito-borne illnesses. Wear long-sleeve shirts and long pants when outdoors. Stay in places with air conditioning, or those that use window and door screens to keep mosquitoes outside. Sleep under a mosquito bed net. Use EPA-approved insect repellent with at least 20% DEET. You may also consider treating clothing with permethrin. We will begin this next segment by discussing infections due to occupational exposures. First, remember that potential infections can be categorized into 3 broad categories, including occupational exposure, environmental exposure, and sexual exposure. When considering occupational exposures, the nature of the exposure is of critical importance. The highest risk of contracting an infectious illness is from exposure to a hollow bored hypodermic needle puncture. However, there is also risk of infection through mucocutaneous exposure with infected fluid contacting the mouth, eyes, nose, or genitalia, as well as with exposure of open wounds. Of note, not all infectious agents carry the same risk for a given route of exposure. For example, the average risk of infection by percutaneous route of exposure is 30% for hepatitis B, 3% for hepatitis C, and 0.3% for HIV. After any exposure to blood or body fluids, skin should be washed thoroughly with soap and water. If a wound or puncture is noted, it should additionally be cleansed with an antiseptic such as an alcohol-based hand hygiene agent. If a mucosal surface is exposed, it should be flushed with copious amounts of water. If the eyes are involved, they should be thoroughly irrigated with saline or water. All travelers should already be vaccinated against hepatitis B prior to travel. Therefore, the main preventable post-exposure concern is HIV. If a suspected or potential exposure to HIV has occurred, post-exposure prophylaxis, abbreviated as PEP, should be taken as soon as possible and no later than 72 hours after exposure. The regimen to be taken will depend on what you are prescribed at your pre-travel consultation appointment, but will generally include Truvada once daily to be taken together with either raltegravir twice a day or dolutegravir once a day. The medication should be continued for 28 days unless otherwise directed by a UCLA faculty member. Please remember that these medications may be taken with or without food. However, if taking dolutegravir, ensure it is taken at least 2 hours before or 6 hours after any polyvalent cation-containing product, such as iron, magnesium, or calcium. This graphic highlights the importance of starting PEP as soon as possible after the exposure. The benefit and efficacy of starting PEP decreases rapidly over time and is generally considered to be of no benefit beyond 72 hours after exposure. After thoroughly cleansing the site of exposure and initiating PEP, you are required to contact the UCLA faculty member on call for handling post-exposure cases in order to determine the necessity of PEP, as well as to make recommendations for baseline testing and follow-up evaluation. Never forget that the best prevention is avoidance of the exposure. Always use universal precautions. Never do procedures without supervision. Do not do procedures if you are uncomfortable, and never hesitate to ask for help. A very important part of pre-travel preparation is making sure that you have received all of the indicated vaccinations prior to departure. The left-hand column are routine vaccinations that all travelers should have up to date prior to departure, including influenza, Tdap, MMR, polio, varicella, and hepatitis B vaccinations. The right-hand column lists vaccines that may be necessary depending on the specific itinerary and region of travel. It is important to schedule a pre-travel consultation appointment to determine which of these vaccines may be indicated for your specific travel. It is important to remember that some vaccinations require multiple doses to provide adequate immunity, and all doses should ideally be completed at least 10 days prior to travel. Therefore, a pre-travel consultation appointment should be made at least 2 months prior to departure to allow enough time to complete any necessary pre-travel vaccinations and to build protective immunity. Depending upon the planned travel itinerary, 2 vaccinations that may be required for entry or departure when crossing international borders include the yellow fever vaccine and the poliovirus vaccine. The yellow fever vaccine may be required for entry to countries in Central America, South America, Africa, and Asia. Some countries may require proof of vaccination prior to entry if arriving from a country known to have yellow fever. This sometimes even includes layovers. Travelers unable to provide proof of having received vaccination at least 10 days prior to entry when arriving to a country where yellow fever vaccination is required may be refused entry or may be forced to undergo vaccination prior to admittance into the country. Proof of vaccination must be provided on an official International Certificate of Vaccination or Prophylaxis card and must contain the signature and official stamp of the licensed vaccine provider. The yellow fever vaccine is a live attenuated vaccine that is contraindicated in immunodeficiency. The vaccine is associated with rare cases of neurologic and visceral disease. A waiver can be written for patients with contraindications to the vaccine. However, whether or not it will be honored cannot be guaranteed, and thus if questions remain, one should confirm with immigration authorities prior to travel. The poliovirus vaccine is another vaccine that may require proof of vaccination depending on the planned travel itinerary. If traveling to Afghanistan, Cameroon, the Democratic Republic of Congo, Mozambique, Indonesia, Niger, Nigeria, Pakistan, Papua New Guinea, Somalia, and China in the Xinjiang province, the CDC recommends a one-time booster dose in adults who completed the initial series as a child. If staying in Afghanistan, Indonesia, Nigeria, Pakistan, Papua New Guinea, and Somalia for more than 4 weeks, then it is required to receive a booster dose within the preceding 12 months and at least 4 weeks before departing one of those countries. Although infection is frequently the focus of many people's travel-related concerns, environmental exposures are just as important to consider. Sun exposure and dehydration are common problems facing the traveler, particularly to tropical regions. When outside, you should make liberal use of sunscreen and wear a hat to protect from excess sun exposure. It is important to keep in mind that UV radiation exposure increases closer to the equator, which means it takes less time to get burned. Dehydration is another common problem that can initially go unnoticed in humid settings, but can cause significant problems for the traveler. Always keep potable water on hand. Remind yourself to drink fluids and stay hydrated. For travelers who may have gone scuba diving, it is important not to fly or ascend to significant elevation for 24 to 48 hours after the dive in order to avoid decompression sickness. Acute mountain sickness is another consideration for travelers who will be ascending to significant altitudes. Common symptoms of acute mountain sickness include headache, lightheadedness, loss of appetite, nausea, vomiting, fatigue, sleep disturbance, and mild shortness of breath with exertion. Rapid ascent tends to worsen the severity of symptoms. Symptoms of acute mountain sickness can be mitigated by slow ascent and prophylaxis with acetazolamide, which also aids in acclimatization. Acute mountain sickness itself may be self-limited and resolve after a few days at altitude, or may progress to more complicated disease, including pulmonary edema or cerebral edema, which can be life-threatening. Treatment of uncomplicated altitude sickness generally involves symptomatic management. Rapid descent may be necessary for severe disease. You should seek medical evaluation if symptoms worsen. High-altitude cerebral edema is a less common but potentially serious complication of altitude sickness that increases in prevalence above 9,800 feet. Common symptoms include abnormal gait, severe weakness, irritability, confusion, impaired consciousness or mentation, loss of energy, increasing drowsiness, and eventually coma. High-altitude pulmonary edema is another less common but serious complication of altitude sickness, especially above 10,000 feet. Common symptoms include dry cough and shortness of breath with exertion. Symptoms can progress to include productive cough, with frothy pink sputum to frank blood, as well as debilitating shortness of breath. Treatment generally involves rapid descent as soon as possible. Supportive measures include supplemental oxygen, steroids, and calcium channel blockers until descent can be achieved. You should seek medical evaluation as soon as possible. Although the most common adverse effect of travel may be due to self-limited infectious diseases, the most common cause of serious morbidity to travelers is injury. The #1 killer of healthy U.S. citizens overseas is motor vehicle crashes, whereas only 2% of deaths were attributed to infectious diseases. From 2013 and to 2014, an estimated 1,670 U.S. citizens died from non-natural causes, such as injuries and violence. 27% of those deaths were in road traffic crashes. In the interest of keeping safety first, always wear seatbelts and consider the safety of the vehicle before taking a ride. If you decide to do the driving yourself, make sure to become familiar with local driving laws and conditions before getting behind the wheel. Avoid driving in left-hand traffic conditions, and be aware that many countries outside North America use manual transmission vehicles. Avoid driving at night, and never drive under the influence of alcohol, drugs, or sleep deprivation. Sexual violence remains a concerning problem in travelers abroad. Around 90% of victims are women, and high rates of sexual violence have also been reported in U.S. students with non-traditional genders. Steps to help mitigate the risk of falling victim to sexual violence include assessing the level of risk prior to departure to determine if it merits delaying or canceling the travel. Once in country, it is important to remain vigilant and avoid going out by yourself. Limit going out after dark, and limit the intake of alcohol or other mind-altering substances. It is also very important to respect local customs in terms of social etiquette and proper dress to avoid causing offense or unsolicited attention. In the event one has fallen victim to sexual violence, it is important to get to a safe place as soon as possible. Call the UCLA emergency line if you feel comfortable doing so. Seek medical evaluation if needed. Contact the U.S. Embassy in your location to determine next steps in reporting the incident. Please note that staff and faculty are required to report any cases of sexual assault that they have been made aware of to the Title IX office. Air travel, though generally safe, does portend the risk of developing a deep vein thrombosis or DVT. The risk of DVT increases with the length of flight, and an ongoing risk remains for 2 to 8 weeks after travel. Pre-existing conditions may predispose one to a higher risk of DVT, and thus it is important to discuss this with your physician at the pre-travel consultation appointment in order to determine if prophylactic measures are indicated. General preventative measures against developing DVTs include frequent mobilization, staying well hydrated, avoiding sedating medications or alcohol, wearing compression stockings, and regular flexing and extending of the ankles and knees, such as by walking around during the flight. Jet lag is a common experience in travelers journeying on long flights and affects most travelers crossing 4 or more time zones. Symptoms include sleep disturbances, daytime fatigue, gastrointestinal upset, and reduced productivity. Preventative measures include the use of melatonin and adjusting your schedule to the local time upon arrival. All travelers should sign up for UC travel insurance and register their itinerary prior to departure. If your plane ticket is purchased through UCLA Travel, you will be automatically registered and should receive confirmation of insurance coverage by email. A printable travel insurance card with phone numbers will be available and should be kept with you at all times. If you become ill and need help navigating the UCLA travel and evacuation insurance, call the emergency line for assistance. This slide lists important emergency UCLA contact information that you should keep readily available in case of emergency. Please remember that a UCLA faculty member is on call 24/7 to assist in cases of emergency. This slide lists important additional online resources where you can find additional health and safety topics discussed as is pertinent to your itinerary. Thank you for watching this tutorial. Please do not hesitate to reach out to the faculty of the Global Health Program or your faculty advisor for help in answering any additional health and safety concerns that may arise prior to or during travel. And remember, while you do need to make efforts to stay safe and healthy, travel opens you up to a whole new world of experiences and opportunities.